Hello, Dr. Garry. Thank you for joining us today.
Pleasure.
We've been working with Medica for a while, but Medica is one of the largest teleradiology firms in the UK. You're a listed firm. You work with more than 100 NHS trusts, right? So can you tell me a little more about Medica and possibly some of the work that you lead?
Yeah, sure. So as you said, Medica is a teleradiology company. So our raison d'etre is that we take scans from hospitals which don't have the reporting capacity themselves, so they outsource it to us to do the work and turn around an accurate and rapid report for them. We've got lots of clients, and we do in the order of about 1.5 million studies per annum of reporting, a mixture of both cross-sectional CT, MR and plain film. And we've got about 500 or so radiologists who work for us. So really big repertoire of case mix and people that we work with and for. In terms of my role at Medica, my background is I'm a consultant radiologist by training. I'm also a software engineer and a programmer, and have a personal interest in kind of AI and how we can use software to make imaging safer, better, faster. Specifically at Medica, I started off as a reporting radiologist, just grinding away reporting scans, of which I still do, but a lot of my role also now is involved in auditing work that we do to make sure that our reports are accurate and safe. And I help with Medica's future tech plans, which is our ongoing program to improve ourselves through software innovation.
You've been instrumental in bringing AI to Medica, and you've been working with Qure's head CT solution. Can you tell us a little bit about the experience and why and how it's been helping your team?
Yeah, so I'm a small part of a big team that have been able to bring AI into clinical use. So we partnered with Qure a 1.5 to 2 years ago with the explicit goal that we wanted to bring artificial intelligence to our workflows. We can see where the sea is moving to, and we know that artificial intelligence is really helpful in improving patient safety and improving turnaround times and accuracy. So we have implemented the Qure algorithm, which is Qure's algorithm for detecting intracranial hemorrhage amongst many other things on brain CTs. And what we needed a tool that could help us decide which scans were abnormal quickly, so that we could get them into the hands of a reporting radiologist quickly to turn around a report. We wanted to move away from just doing the scans in the order that they arrived, because we were mindful that where we would have most impact was finding a pathology that's most likely to help patients, most likely to have good clinical impact. And so the Qure algorithm has helped us identify which scans are abnormal, and then we can get them reported and back to the trust as soon as possible. Implementing the algorithm, working with Qure, has been fantastic, frankly. We have in-house software development teams, and we have a lot of smart IT guys, but the help that Qure, the expertise, I should say, that Qure has been able to bring to us, and their flexibility to modify their tool if needed, to help us integrate into some of our bespoke systems, has been great. And really grateful for the working relationship.
With you as well. As far as a teleradiology firm is concerned, turnaround time is one of the most critical parameters, right? But what are some of the other benefits that AI has been providing?
So, like you say, turnaround time is really important, not just for the bottom line profitability, but also just for patient safety. But at the moment, we have quite a lot of, at this point, anecdotal data from our large body of reporters, and personally from myself, that the tool is not only making us report quicker, but also more safely. I've had many conversations with people who have been grateful that the algorithm has spotted something that they themselves perhaps didn't see, and it's caused them to have a second look at the scan before they verify their report. And as we move forward, and we're very proud of ourselves at Medica in that we audit a certain percentage of all of our studies, to check for errors, so that we can correct them and we can learn from these mistakes. And I think AI moving forwards is going to have an increasing role in helping us to do that, to helping us to identify where abnormality was found and perhaps we didn't see it, or vice versa, so that we can reconcile what the AI is telling us and what we've reported. And I think there's a lot of work that can be done in that area moving forwards. And certainly I've seen examples where we've had an error made, which happens from time to time, and the QER algorithm has seen the pathology and perhaps a reporter has not seen it. And the reason that's come about is because we didn't have the overlay in time. And so we already have anecdotal evidence that these algorithms can really help lower our error rate, make us better radiologists. They're very powerful tools.
NHS as an organization is always looking to optimize its resources, right? So how do you think AI can play a role in reducing costs?
I think it is definitely going to have a role in reducing costs. Speaking as a member of a private organisation, I probably am a bit more suited to talk around that area than the NHS specifically, or I will come back to the NHS. AI is going to help us be more accurate in our reports. It's going to help us be faster. And I think that in itself will save money, because if we are more efficient with our time, we can get through more work more safely, more accurately with the resources that we have. So that in itself is a massive cost saving for us. Also, from a private enterprise, we have targets to meet, in that clients rightly want to get a report back within a fixed time frame if that's what we've promised them. And if AI helps us to spot the abnormalities and surface the important ones quicker, then we're able to do that much more reliably than without the tool. For the NHS, I think similarly, there are going to be big savings in terms of workflow management, which we're seeing in the private sector as well. I think we're still quite a way away from AI being able to give a full report on a scan without human input, but AI is fantastic as an adjunct. It's fantastic at improving efficiencies by reducing the time taken to give an accurate report, and also prioritization, which is what we use the algorithm for at Medica in the first place. We are principally not using it to flag to the radiologist that there's an abnormality, although that's a nice side effect that the tool gives us. We're principally using it to give the abnormal scans to the radiologist as soon as possible, allowing the less critical scans to wait slightly longer to be reported. And I think those efficiency gains, they can be realised in many modalities across many specialties in the NHS.
How has the experience been working with the Qure team?
Oh, it's been great. As a company, Qure clearly got an awful lot of smart people who work for them. They take a lot of pride in their product, and there's obviously a lot of thought that's gone into it. Not just superficially how the front end is presented to us, but how it's engineered, how straightforward. I'm not saying problem-free, but how straightforward it was to integrate into our system. We have a lot of bespoke systems at Medica, which we've been able to get Qure integrated really seamlessly. They've been a very agile company in terms of when we've had issues or problems or needed some modifications. Qure have been really happy to work with us, which we're really grateful for, and frankly, been a fantastic partner to work with. So we've been really happy.
It's been incredible for us as well to partner with you at Medica, and we look forward to a longer journey together. And thank you so much for your time, Dr. Garry.
No, you're very welcome.